Autoimmune hepatitis is a disease that may lead to liver cirrhosis, liver cancer, and death, or the need for liver transplantation. In 4% of all liver transplantations, autoimmune hepatitis is the underlying liver disease. The diagnosis of autoimmune hepatitis is based on clinical and laboratory parameters. Autoantibodies are important diagnostic markers. Presumably, they are not mediating pathogenesis itself. Liver histology is important for the diagnosis of autoimmune hepatitis, in particular discovering major fibrosis or excluding other diseases. So in summary, important for grading and staging of disease and differential diagnosis. There are scoring systems available that are their major use is for clinical trials to identify homogeneous populations, but there is a simplified scoring system that may only be used in individual patients. However, there are challenges in differential diagnosis. Recent challenges come from the use of biologicals in various diseases, including chronic inflammatory diseases or cancer. Examples are checkpoint inhibitors or other biologicals like TNF antibodies and CTLA-4 antibodies. Here the disease may resemble autoimmune hepatitis. Treatment with autoimmune hepatitis is beneficial. Autoimmune hepatitis has been the first liver disease where treatment has shown to improve survival. The standard of care is steroids alone or in combination with azacitidine. However, usually these drugs have to be taken lifelong. When terminating treatment, up to 80% relapse. There may be failure to the standard of care, either due to side effects, for safety issues, or lack of efficacy. For safety reasons, the topical steroid budesonide may be used in non-cirrhotic patients. There are less side effects with equal efficacy. If there is lack of efficacy, then several drugs have been used. However, all these drugs that have been used, like mycophenolate, like cyclophosphamide, or others, including biologicals, have never been approved for this indication. Recent focus was in the treatment of those not responding to standard of care with steroids or azacitidine, TNF antibodies and antibodies targeting the B lymphocytes, including anti-CD20 and a very recent antibodies targeting at BAF. Overall, innovative therapies are an unmet need because those not responding to standard of care are those patients progressing to cirrhosis and the need for liver transplantation. Thank you very much.